Let's quickly get into it and speak on the sentiments of the health minister, who said pharmacists apparently are stealing drugs to take to private clinics. Do you believe that health institutions are porous to an extent where we're even seeing the stealing of drugs happening within the health institution itself?
I think one thing that we need to ask a question is do these people steal the medication? The harsh fact is, yes, it's true. They do that. You see? But the other thing that we need to ask is some people may say that there may be a problem with some facilities or having some stock out. But again, the question we need to ask ourselves is, have you ever heard that pharmacists are not going for work because hospitals have no drugs? The answer is no. They always go for work on a daily basis. So meaning that they find the drugs in hospitals and they do give the drugs to the members of the public.
You say yes that, from some health institutions and from the pharmacies, there are pharmacists who are stealing these drugs, the medications within hospitals. Do you think that this particular shortage that is being faced in the public health institutions, pharmacies, is this particular issue here, the stealing of drugs by these pharmacists? Do you think that we can attribute that shortage to the stealing of drugs?
You see, what I can say is when we talk of someone taking something that does not belong to them, that will create a shortage for the rightful owner who's supposed to receive that medication, not to receive it. So in this situation, we are saying we have, yes, good pharmacists who work on a daily basis, who work tirelessly to improve the system. We have also the bad ones who see opportunity to get these medications and steal for their own selfish gain, which is very much unfortunate. And it's a harsh fact to know. And the best thing that we need to know, to see, is what the minister requested when she visited Matero. She asked the pharmacists to take responsibility in everything that is really happens concerning the medication. You see, people should feel saved by the government, because those drugs that are found in private institutions that are for the government can be traced to know exactly which location those medications they come from, because all the medications that are dispersed by ZAMZA are dispersed by batch numbers. So when you find a government medicine in a public institution, you can use the batch and you can know exactly which facility that medication has come from. So now that the government doesn't do that, does not mean that the government is down or the government doesn't know what's supposed to do. No, because they say, no, let's just deal with this person we have caught with these drugs and let's take them to court and all that. We heard about 2 months ago or so, where a pharmacy technologist was found with a serious medication in Northern Province. We have heard about all these stories coming up and out and there. We have heard government drugs found in Angola. We have heard ARVs and malarials, all that. Myself, I'm a victim of reporting a government drug found in a private pharmaceutical wholesale. And instead of that company being suspended or blacklisted, but I ended up lying for my life. That's what actually that happened in the previous administration. So these things that people are talking about are truth. Now what the profession needs to do, what the pharmacists need to do, is to reform and take responsibility concerning the issues of drugs, so that they should make sure that no one touches the medication apart from them. Because when drugs go missing, the blame comes to them. So they need now to take the responsibility. And this happens because they don't want to take it, or they don't want to be responsible concerning the matters that they are employed for. And these are issues concerning the drugs.
Well, you've mentioned that it's been happening for a little while. Do you think that there has been negligence on the part of government to follow these things up? I mean, from the previous regime, now we're getting to see this happening at this particular moment.
You see, what I've seen and what I've observed is there have been no seriousness in terms of how the drugs they leave out to patients, how in terms of the issues of accountability. We account for drugs from the drugs from Zamsa, which is the main store. Then we account for drugs as they enter the storerooms in different hospitals, but we don't usually account for drugs once they go to these health facilities, especially health posts, and also mainly the dispensary. This is where the main issue for me, I feel, is, and we need to digitalize the supply chain of drugs, especially to the patients. If we are failing to digitalize the supply chain for drugs to patients, then this issue of drugs going missing will continue, because it will be like me. You are a pharmacist or you are a pharmacy technologist. I come at a dispensary, I get you 18 or 3 tins of the same medication, or you are working at a certain facility. It will be considered like, look, you have given the medicine to the patients, but no, you have given those medications to one person who's going to do it in the wrong way. But if we digitalize everything, where we know how much medication has gone to a certain individual, a certain patient, and we know how much medication has remained, you'll find that even the issue of preference will be the thing of the past. What I don't like is to defend the people who are doing the wrong thing. What is needed is people are doing the wrong thing. We need to tell them off and say, stop the wrong thing you are doing and do the right thing for the benefit of every citizen of this country.